As I'm sure most of us are aware, one thing that we see with aging is that there is issues of cognitive decline, especially in individuals that are more at risk for dementia. And one aspect of that risk is looking at things like vascular dementia. And so, for instance, we know that stroke is the second leading cause of dementia. And so one aspect of that in particular is cerebral small vessel disease, also known as subischemic vascular cognitive impairment. One thing that we see with subischemic vascular cognitive impairment in particular is that these individuals experience certain aspects of clinical presences like things like white matter hyperintensities and things of that nature, which are associated with executive decline, the issues of memory and attentional processing and things of that nature. The other thing that we also see as well is that oftentimes these individuals will have mobility impairments as well. So with this in mind, we actually performed a study quite a while ago, back in 2014, if I remember correctly, wherein we were able to show that resistance training was able to reduce white matter hyperintensities in women. So what we were interested in trying to do in this case was to see whether resistance training could also be beneficial for reducing things like white matter hyperintensities and promoting cognitive function in individuals with cerebral small vessel disease. What we were thinking is that by being able to develop this intervention, this might actually be beneficial, especially for individuals with cerebral small vessel disease, because it doesn't involve having individuals walking or doing any sort of aerobic training, which may lead to falls and things of that instance. So we figured that resistance exercise in particular may be a really good therapy in particular for this population. So the study was a 12-month randomized control trial wherein we randomized 91 older adults to one of two different interventions. All older adults in this study had the presence of white matter hyperintensities and also had cognitive impairment defined as a Montreal Cognitive Assessment score of less than 26. For the resistance exercise group, these individuals received twice weekly resistance exercise, wherein they performed a series of different exercises, including body weight exercise, training on different machines, so leg press, chest press, and things of that nature. And then they also performed things with dumbbells and some small free weights as well. The other group received twice weekly balance and tone control, which is basically just a combination of flexibility training, things like stretching, that nature, and then also balancing exercises and things like that. And we oftentimes use that as an active control group in order to be able to really look at what is the largest detectable or the most conservative effect that we could expect from that particular therapy that we're interested in. In terms of the results of the study, the results show that this resistance training group actually improved in cognition at 12 months relative to the control, and we also saw that there were some benefits to mobility as well. And so with that in mind, we think that these results seem to suggest that this type of therapy may be beneficial for both cognitive function but also for physical function as well.